Hey everyone, welcome to Marvel Medicine. My name is Dr. Chaudry. This lecture is on the lymphatic system. Imagine a city or town and all of the households within that town. Then think about each of those houses or buildings. Each one of these uses certain goods, groceries, and makes a certain amount of garbage, right? Well, what happens to that garbage? It gets picked up by the sanitary department trucks and brought to the sanitary centers for disposal. The lymphatic system is like the sanitary department, and the trucks are the paths that bring stuff back from tissues around your body. What stuff are we talking about? Well, continuously throughout the day, all of your cells are undergoing biochemical pathways, such as glycolysis and the electron transport chain. There are millions of these processes going on. Throughout these cycles and pathways, a lot of junk or byproducts gets made that your body just can't recycle or use. So it sends it out away through the lymphatics. Think about your immune system, your macrophages, Langerhans cells that are constantly eating up millions of bacteria, parasites, viruses, and other particles. This stuff gets left over in the interstitial space, and well, what happens to the junk left over? The lymphatic system picks it up to bring it to your bloodstream to get rid of it. Well, why don't these things diffuse through capillaries into the bloodstream? Because most of the capillaries don't have pores that are big enough for the proteins to get through. If we didn't have the lymphatic system, the interstitial space would get overwhelmed with these proteins. What would happen then is that the protein would make the oncotic pressure in the interstitium increase. If that happened, water would stay in the interstitium with the protein, and you would develop edema. This is why some people who get breast surgery, called mastectomy, can develop edema in their arm on the side they had the surgery, because the surgery cuts off the lymphatic supply to that arm, and it can no longer empty out its interstitial junk. A little anatomy now. Most of the lymphatic system from the lower half of your body empties into the thoracic duct, which goes up and dumps into the left internal jugular vein. This is one of the reasons why, when putting in a central line, we insert it on the right side. The US Assembly loves this anatomy topic. They may ask a question like, a patient has a big surgery. 5 days after the surgery, the team notices the patient's lower limbs and left arm are edematous. Which of the following procedures did the patient most likely have during the surgery? They might give answer choices like A, right internal jugular central line, B, left IJ central line, C, right femoral line, D, left femoral line. The correct answer would be a left internal jugular central line. Lymph fluid from the left side of the head, left arm, and some areas of the chest empty into the thoracic duct as well. The right arm and side of the body empties into an area of the venous system between the right subclavian vein and internal jugular vein.